Bethesda framework. Within the Bethesda system, organisms and infection-associated cytopathic changes are classified among the non-neoplastic findings that may be encountered in cervical cytology. Their presence does not by itself exclude a diagnosis of negative for intraepithelial lesion or malignancy, or NILM. NILM specifically means that there is no cytological evidence of an epithelial neoplasm. It does not mean that the smear is completely free of organisms, inflammation, or other benign abnormalities. Reporting these associated non-neoplastic findings is optional within the Bethesda framework. Two assessments must therefore remain separate. First, determine whether an organism or characteristic viral cytopathic effect is present. Second, independently evaluate the epithelial cells for a squamous or glandular abnormality. If a genuine epithelial lesion is identified, it must be reported. Trichomonas vaginalis. Trichomonas vaginalis is identified in cervical cytology by recognition of the trophozoite. The organisms are usually oval to pear-shaped, with a defined cytoplasmic body, an eccentrically located nucleus, and cytoplasmic granularity. Degeneration and fixation may distort the classic pear-shaped appearance, so diagnosis should not depend on an ideal textbook shape. Flagellar remnants may occasionally be visible, but they are often inconspicuous and should not be required for recognition. The background is often strongly inflammatory, with numerous neutrophils. Compact neutrophilic aggregates, sometimes described as polyballs or cannonballs, may provide a useful clue and should prompt a careful search for trophozoites, but they are not diagnostic by themselves. Long filamentous organisms such as leptothrix may also coexist and similarly act only as a search clue. The main mimics are neutrophils, naked or degenerated squamous nuclei, histiocytes, cytoplasmic fragments, and debris. Neutrophils show segmented nuclei, while naked nuclei lack a defined cytoplasmic body. A convincing diagnosis, therefore, depends on identifying a repeated population of similarly formed organisms with characteristic cytoplasm and an eccentric nucleus. Associated squamous cells may show reactive changes including eosinophilia, degeneration, and perinuclear clearing. These halos should not be mistaken automatically for coilocytosis. True HPV-related L-cell requires accompanying nuclear atypia, ED regardless of any accompanying infection. Pap cytology can provide characteristic morphological evidence of infection, but it is not a comprehensive microbiological test. Organisms may be highly convincing when seen, while their absence on the smear does not reliably exclude infection. Candida CP. Candida is recognized cytologically by fungal yeast forms and pseudohyphae. The yeast forms are small, round to oval, and may show budding, while pseudohyphae appear as elongated, segmented fungal structures that may branch and extend across groups of squamous cells. In liquid-based preparations, pseudohyphae may pass through or spear aggregates of squamous cells, providing a useful low-power clue. However, pseudohyphae are not always prominent, and some Candida species may appear predominantly as yeast forms. The organisms may be accompanied by neutrophilic inflammation and reactive epithelial changes, including nuclear enlargement, degeneration, and cytoplasmic vacuolation. These changes should remain interpreted as reactive unless the epithelial cells independently show convincing dysplastic nuclear abnormalities. The major mimics are mucus, fibrin, elongated bacteria, and actinomyces. Mucus and fibrin may appear filamentous, but lack true budding yeast and pseudohyphal architecture. Actinomyces, in contrast, forms dense colonies composed of much finer branching bacterial filaments rather than the broader pseudohyphae of Candida. Species-level identification is not reliable from Pap morphology alone. Therefore, the Bethesda terminology is fungal organisms morphologically consistent with Candida sp, rather than naming a specific Candida species. Shift in flora suggestive of bacterial vaginosis. In bacterial vaginosis, the normal lactobacillus predominant flora is replaced by abundant small coccobacillary organisms. The most characteristic cytological finding is the clue cell, a mature squamous epithelial cell whose surface is densely coated by adherent coccobacilli. This produces a finely granular or stippled cytoplasmic surface and obscures the normally sharp cell border, giving it a fuzzy or shaggy appearance. Bacteria merely lying around or overlying a squamous cell are not sufficient to define a true clue cell. Inflammation is variable and is not a defining criterion for bacterial vaginosis. The diagnosis should instead be based on the characteristic flora shift and convincing clue cell morphology. In conventional smears, a diffuse bacterial film may also be prominent in the background. In liquid-based preparations, the background is usually cleaner, although the coccobacillary coating of clue cells remains recognizable. Importantly, Pap cytology does not identify Gardnerella vaginalis specifically and cannot establish a definitive clinical diagnosis of bacterial vaginosis. Bethesda therefore uses the terminology shift in flora suggestive of bacterial vaginosis. This wording reflects recognition of a characteristic polymicrobial cytological pattern rather than identification of a single bacterial species. Actinomyces-like organisms. Actinomyces-like organisms are typically identified as dense basophilic colonies composed of numerous delicate, tangled, and branching filamentous organisms. At low power, the colony may have an irregular woolly or cotton ball appearance. At higher magnification, fine filaments can be seen radiating from the dense central aggregate, often accompanied by a prominent neutrophilic inflammatory response. The major cytological differential is Candida. Candida shows broader pseudohyphae, usually accompanied by budding yeast forms, whereas Actinomyces forms a compact colony of much finer branching and radiating bacterial filaments. Mucus, fibrin, and nonspecific bacterial aggregates may also mimic colonies, but they lack this characteristic filamentous architecture. Actinomyces-like organisms are strongly associated with intrauterine contraceptive device use. However, their presence on a Pap smear does not establish pelvic actinomycosis. Cytology demonstrates organisms with compatible morphology, but cannot demonstrate tissue invasion, and the clinical significance of this finding must therefore be interpreted separately. Accordingly, Bethesda uses the morphology-based terminology, bacteria morphologically consistent with Actinomyces spp, rather than diagnosing actinomycosis from cervical cytology alone. Herpes Simplex Virus. Herpes Simplex Virus differs from the preceding organisms because cytology identifies the viral cytopathic effect in infected epithelial cells, rather than the virus itself. The characteristic changes are predominantly nuclear and include nuclear enlargement, multinucleation, nuclear molding, chromatin margination, ground glass nuclear change, and intranuclear inclusions. Three important features can be remembered as the three MIS: multinucleation, molding, and margination. In multinucleated cells, the enlarged nuclei may press against one another and conform to adjacent nuclear contours, producing molding. Chromatin becomes displaced toward the nuclear membrane, producing peripheral margination with central clearing or a ground glass appearance. However, no single one of these features is diagnostic by itself. Intranuclear inclusions may also occur. Classic Cowdery type A inclusions appear as dense intranuclear inclusions surrounded by clearing and marginalized chromatin, but a well-formed inclusion is not required in every infected cell. The major diagnostic pitfall is confusion with squamous intraepithelial lesions, particularly H-cell. Mononuclear HSV-infected cells may appear markedly atypical, but viral chromatin margination, homogeneous ground glass nuclear change, characteristic inclusions, and molding in adjacent infected cells favor HSV. Multinucleation alone should never be used to diagnose herpes infection. Under Bethesda, this finding is reported as cellular changes consistent with herpes simplex virus. Cytomegalovirus. Cytomegalovirus-associated changes are uncommon in routine cervical cytology, but are included within the Bethesda category of organism-associated findings. The characteristic finding is a markedly enlarged, or cytomegalic, infected cell containing an enlarged nucleus dominated by a large intranuclear inclusion. A clear zone may surround the inclusion, producing the classic Oll's eye appearance, and cytoplasmic inclusions may also be present. The distinction from herpes simplex virus is useful. HSV typically produces a constellation of multinucleation, nuclear molding, and chromatin margination, whereas CMV is more characteristically dominated by a markedly enlarged inclusion-bearing cell. Under Bethesda, the appropriate terminology is cellular changes consistent with cytomegalovirus, integrated diagnostic approach and reporting. The presence of an organism should never end the examination of the smear. Infection and inflammation may produce nuclear enlargement, binucleation or multinucleation, degenerative hypochromasia, cytoplasmic vacuolation, and perinuclear clearing. These changes may appear atypical, but none of them alone establishes a squamous intraepithelial lesion. Interpretation should therefore remain pattern-based. A perinuclear halo is not automatically a coilocyte. True HPV-related atypia requires appropriate nuclear abnormalities. Multinucleation alone is not diagnostic of HSV. Look for the complete viral nuclear pattern. Filamentous material is not automatically Candida. Confirm fungal architecture. Bacterial coating does not define a clue cell unless adherent coccobacilli produce the characteristic granular surface and obscured cell border. And Actinomyces-like organisms on cytology do not establish pelvic actinomycosis. Most importantly, infection and epithelial abnormalities can coexist. After identifying an organism, continue evaluating the epithelial population independently for ASC-US, ASC-H, L-sil, H-sil, glandular abnormalities, or malignancy. The practical approach is therefore consistent throughout. Identify the organism or cytopathic effect, assess the background and epithelial reaction, exclude the closest mimic, independently evaluate for an epithelial abnormality, and then apply the appropriate Bethesda terminology.